I'm Dr. Qazi. I'm a skin restoration specialist in Newport Beach, California. I have a really nice case I want to talk to you guys about. This is a patient who I've been actually seeing for years and years now, and he came to me for his skin condition. He's actually a swimmer, really active outdoors, and just had years and years of sun damage. He had wrinkles that were really bothering him. He had a lot of pigmentation that was bothering him. So I want to show you, basically, I did this part one time, and then I ended up doing around his eyes another day as well, which ended up helping a ton for him. So I'll go through this case a little bit because it's really cool. This is what we do a ton of also. I know we showcase a lot with scars, but I actually also do a lot with restoring patients' skin as they get older. And part of what I did actually for this patient is really interesting because we used a combination of different lasers. We used a CO2 laser as well as a fully ablative erbium laser. And then what we also did was a dilute form of radius through the laser tunnel holes. And we also put some, for him, we actually did some PRP as well, which helped out a ton. So I'm going to go through a little bit of this as more people come on, just to kind of give you a general overview of how we could do lasers. This is really laser season. It's really like anti-aging, really big time actually. Right now, this month actually is when it picks up because people really want it for Christmas time. So he got ready actually just about 7 to 10 days afterwards. This is really for anti-aging. Of course, we could do this for patients with scars. In fact, I did a patient today. He had some acne scars, but he wanted more like full facial rejuvenation. So I ended up doing that for him as well. And you can see just, for patients like that, we could actually do things to make them look significantly younger. This patient, I've been working on him really for, I believe, 4 years now, and really nice gentleman. And so I see him really regularly actually as well. He comes in also for hair PRP. And so I just kind of see him in the hallway. His skin still looks amazing, still looks really good. And he's a swimmer. He swims outdoors actually. He swims at the beach in the ocean. So it was like kind of a concern. Originally, the first time we ended up doing it, doing the laser, I was worried because he had the goggles on about going too strong around the eyes. Then he really promised that he's going to be okay with without swimming for a couple weeks. And so we ended up doing his eyes. I'll show you actually his eyes actually as well. You can see this process here for a second here. I'm going to show you that. Let's see here. How about verporphin acne scars? I'm going to make a whole YouTube video about my FDA process at some point when I have some time, probably by the end of this time. We sent a letter. We've sent multiple letters. Actually, I'm going to show all the emails we sent over. But we sent an email like in October, which we finally had a response from. And they told us that they were going to get back to us, and they didn't. So, it's great, and then we followed back up and they still didn't get back to us. So it's like, I'm not sure what's happening with the FDA. Hopefully there'll be like a change with the situation there. But I do think it's worth kind of educating everybody about what happens with the FDA there. Audrey's saying, does Subcision laser make your skin temporarily look worse for a little while? Well, it could be. It could end up being a little bit red, for example, which could potentially make it seem as if it's a little bit worse, especially with scars. Sometimes it's a little bit more red, or it could be pigmented too, and that could be a little bit worse before it gets better. Sometimes with these kind of treatments, when we're doing more for anti-aging purposes, it could get really dry for a few weeks. But I don't really run into those problems because of the way we prep the skin and then afterwards what we use. None of our patients use like expensive skincare or anything like that. I try to make it so it's really affordable for patients for the skincare. I just want to be able to have it so that they can keep these results. So it's not about that really. It's just mostly about sunblock. And a lot of times, like I use our pigmentation cream, or sometimes we introduce like tretinoin, things of that nature to really help out patients get really great results. User 17 is saying, are you able to get good results? Go aggressively. Where did it go? With medium skin tones. Yeah, absolutely. I could show another patient, a Hispanic patient, really great results for him for anti-aging purposes. Are you talking about for that, or are you talking about more for like scars? What are you requesting there? G-Bay is saying, when would you recommend a phenol peel? This patient could have potentially been, but he didn't want the downtime of the phenol peel. So he, he's the right skin type for it. And everything else was okay, but he's a swimmer, really, really active, wanted to be able to bounce back. So I wanted to just basically tailor it with a laser so that we could just basically get about 7 days of downtime. That's pretty much all he was willing to give me for himself, because he does go a lot. He's very, very active lifestyle, and he wanted to go back to swimming, which is a big deal for him. And he's in, at the time I treated him, I believe he was in late 60s. Now he's in his 70s. And so it's like, I want him to stay healthy too. Most creative is saying, can you fix indented scar in the corner of eye and nose? Yeah, we could. I did actually today with a patient, yesterday as well. A lot of times it involves using a laser around the edges of the scar. And then sometimes we could place a little bit of a product, maybe something like Beliful, for example. I use that sometimes for that area. Let's see, your Fraxel laser good for melasma? I don't think it's good for melasma, actually. I think you would be hard-pressed to find great results for melasma. I think it's really temporary for that, but really the problem is that there's way too much heat for the vast majority of patients who have melasma, who tend to actually be a little bit older, not just older, but I should say that who tend to be more Fitzpatrick 4 and above, which means that they are a lot more sensitive with heat. So even IL patients with melasma patients are sensitive with that, but particularly patients who are darker skin type, because now you're not only battling the melasma, but you could end up getting something called post-inflammatory hyperpigmentation with that. And so it's a lot more challenging. So I use the Pico laser, works very, very well. You could also use a Q switch, but Pico laser at this point works very, very well. Danielle saying, oh, I missed her question here. We're scrolled up there. Okay, let's see. Danielle saying, do you think acne scars are easier to treat for clients under 25? Well, it's tough. I had a patient last week. He's going to be coming back in a few weeks. Now we're doing a skin prep for him. He was, I believe, 24, 25 years old. And really unfortunate story really for him is that he just had severe cystic acne and didn't have access to be able to afford Accutane, but and it ended up getting severe cystic acne. So sometimes that ends up happening where patients don't get appropriate cure right at time. And it's not because they didn't want to, it's because sometimes they just can't afford it. Actually, my patient today, his were in some areas really bad. And he was from Texas, and he was like, I had severe cystic acne when I was a freshman year, and he knew about it, and it was like couldn't afford Accutane. It was just too expensive. I don't think that people talk about that enough. It's like, it's so unfortunate that something like that have to happen. And now, he's 31, 32 years old, I believe. And it's like, now we have to go fix the scars. But a lot of that could have prevented if he was managed appropriately. And I mean, not even just like it was a physician fault in this case. It's just, it's the system's fault. Like, what are you going to do about this? Like, this is unbelievable that for something like this, even if you have health insurance, there's people out there with insurance and it's not covered properly. It's just so expensive. And like I've worked with doctors and they're so ridiculous sometimes. Unfortunately, there's some people who go into the field of medicine and they just, sometimes it could elevate people who could be potentially sociopathic. I don't know, because it's like sometimes the things that they say is like it's really questionable and concerning. Because I'd be like, working with them, and they're like berating patients for not being able to afford medications without understanding the socioeconomic issues that are involved with these patients. That potentially, even if it's to you as a physician, $80, $100 copay isn't that big of a deal. It could be an astronomical deal for this particular patient, and maybe they can't afford it because it's just literally paycheck to paycheck. And it's like, it's unbelievable, like the lack of empathy sometimes that I see. And they'll blame it on, the patient, and they'll say that there's non-compliance and things like that without looking at the fact that, this was a very expensive medication and, they can't afford it. So let's come up with some other options or try to figure something else out. But definitely don't like sit there and berating the patient for the fact that they couldn't afford the treatment. That's like outrageous to me. Like that's like the worst thing that you could possibly do, because it's like difficult for some of these physicians to kind of get themselves in someone else's shoes. And I've said it many times that sometimes physicians, like when they start getting into this thing, they start viewing themselves as like part of a different class than their patients. And it's like, you're still part of the working class, dude. Look at you, look at how you're working. And it's like calm down and like take a look at this and like look at the system and look at the situation that's happening here. And like multiple times I've been walking around and they'll just like put down non-compliance, like all over the chart. And it's absurd. Like, of course, there's some patients. Actually, it turns out there's actually very, very few patients, to be honest with you, who are non-compliant. A lot of times it is like there's something else going on. I myself, I actually was kind of non-compliant when I did the laser. To be honest with you, I actually wish I was more compliant because it took a little bit longer for the recovery time for my pigmentation. And I find a lot of times the physicians that I have are a bit more non-compliant than the regular patients. Actually, like this patient, super compliant. This is a patient with a very active lifestyle who never really used much sunblock or anything like that. And then I told him what to do and he did everything. And now for like 4.5 years that I've been working on it, maybe 5 years now, it's beautiful skin, amazing skin. I see him in the hallway all the time, because he does hair PRP for us. And it's like, it's awesome. It's like the result looks amazing. He's super compliant. So it turns out people are actually a lot more compliant than actually people think, which is kind of interesting. Of course, there's some people that are outliers and things like that. We want to work with that. But actually, there's a lot of people that do want to take care of themselves. And maybe there's just like some sort of gap that you're missing. Maybe it was like too irritating for whatever happened or anything. Maybe there's another option there that we could take a look at. But it's also, patients need to kind of look at that and see what we could do to help out to push you and get better results. And then maybe with coupons, things like that. Let's see here. Does retinol work for crow's feet? Botox is definitely going to be better. I wouldn't really say retinol. That's a little bit too irritating there. Am I family with Dr. Nadir Qazi? No, I met her before. I'm not family. I'm not related at all with her. But I met her. She was a nice person though. Jawad saying, why do people not have acne scars even though they had cystic acne? Really, it's genetics, to be honest with you. It really is. Some people just really do break down the cystic acne in a way that could cause scarring, and some people don't. Sometimes there's this hyperactivity really of your immune cells as it's attacking the acne bacteria, and then that ends up causing a scar. And you'll see a lot of times, not every time, but a lot of times it'll be like someone else in the family, either your mom or your dad or like a sibling that has acne. G saying my genetics have me scarring so easily. Yeah, it probably is honestly genetics in your case. And it's like, dismissed by a lot of people. They don't really recognize the fact that genetics is such a big role for a lot of the stuff. And I think it's just important to be honest with that. I do think that it's like important just to be like aware that there's some element of these things that are just genetic. It's like, I do want you to, I could optimize things. Obviously, if we follow things through things, we're going to make sure that we could get there eventually. But some of the times it's like the results could be a little bit faster because of genetics. It's true. Ethnicity, genetics, all those things matter. Let's see here. I missed a few things here. Most creative saying, I have so many scars and tiny hypertrophic scars all over my chest and body, combination scars. I had a patient that flew in from New York the other day, very similar type of issue with that. I help a lot with that. I can help with both of that. Let's see here. Audrey saying, is it normal for scars to look the same after subcision? Does it take a bit for them to look better? Well, it depends. If there's really like volume loss, it may be that there's volume loss. Although, you're saying in the next follow-up, it says, I don't have much volume, but I did subcision last week. Audrey, who did subcision for you and like how did they do it? That's kind of like the things that we could take a look and see, like what was the thing that was involved with it, how stuck it was, and then we could kind of have a better idea there. Let's see here. Best hydroxy acids to help clients with PIH. So you can actually use Paula's Choice one. It's actually pretty good. I know there's a bunch of other ones though. I used to use Paula's Choice back in the day, so I like it. But there's a bunch of other ones that's cheap too. So maybe consider that and just do it like once a week. But really what I usually use for like more mild PIH is actually Eucerin's pigmentation cream, to be honest with you. It actually works very well. Eucerin's anti-pigment cream. Just slower, but try that. And then of course we could do the lasers like the Pico laser works very well. Are growth factor serums worth it? Do something? I don't really think so, honestly. I think maybe mildly it may help a little bit. I did try it for a while. I was told it was going to help out a ton. I didn't find like it was going to be this big difference. I think elastin helps for recovery. This patient actually used elastin skin nectar afterwards. It did help with that. But like growth factors tend to be really pricey. I just don't know if like the vast majority of people necessarily need it. Like stick with like really good vitamin A cream, like some sort of topical retinoid. If you want something over the counter difference, fine, but like just something like that. But I wouldn't necessarily say that you should be pushing like the $200 something for some of these growth factor serums. What do you do about blood vessels? The sunspots are gone, but not the red. Actually, I did actually, this is an older photo. I did actually recently start going after some of his red spot. It didn't never bothered him, but I did start going after some of those. But we could use the XLV laser for that. That's something we could do for that. And the reason why basically we don't do that the same day a lot of times is because he had a lot of brown pigmentation. We had to clear up that pigmentation to be able to tackle that redness. I see here. Do you think facials work for scars and or active acne? It depends on how it's being done. I don't think it's going to help much for scars, but for active acne, it may help a little bit with that. It may help sometimes, but there's a lot of patients who have done facials before and they get scars because of the way that the esthetician did it, to be honest with you. Sometimes there's nail marks around it. And that could be a problem, because now it's like there's a new scar around the previous scar you had, and it's like the acne is now looks a lot worse. The scar looks a lot worse because of the fact that we did extractions there. Can CO2 laser be used on tan brown skin? Yeah, I talk about that all the time. There's a way to do it. It's a really localized energy for small spots, but I definitely could do it that way. It just depends if it's worth it, if it's needed for patients. Today's 2 patients today were Fitzpatrick 5. I did do it on those 2 patients with CO2 laser. Had to, because there's just very, very deep, thick scars. Just had to do it that way. And they're aware of it. I tried not to. I don't go very aggressive with lasers at all, but I did have to go there and smooth it down with lasers and energy devices that way, and it worked out. It worked out very, very well. I keep it very, very safe. I don't have anybody with permanent pigmentation issues, so there's ways to make sure that we can keep it within a safe zone there for patients. IPL for melasma. I think it's terrible for melasma. Sorry. The reason why is because there's too much heat, too much energy with IPL. In certain patients, like for example, this particular patient, if he had more of melasma, maybe you could get away with IPL, but there's still better options than IPL. This, by the way, isn't from melasma for this patient. This is actually post-inflammatory hyperpigmentation from sun exposure. So it's a different process. That's why you really do get that more complete clearance of his pigmentation over here. I'll show you actually also, since we're here, I will show you his eyes too. You can take a look at this. I would circle back with him when he said he was not going to have to wear the goggles as much, so I ended up going a little bit stronger for his eyes, and you can see, look at that amazing contraction, and still like that today. It's awesome. He was debating between doing surgery versus laser, but again, didn't want the downtime of surgery at the time, and so we opted for laser, and it worked incredibly well. He had some pigmentation there too, so I think it was a really good idea for him to do it, and it's amazing right there. Let's see here. Most people do very basic subcision. Look at Dr. Qazi's YouTube videos. Appreciate you, Sailor Moon. Yeah, I do. The subcision. The way I do subcision, very, very different than I would say almost anybody else's that I know of in this area, especially. And there's just a way I do it to make sure that it's really broken up very thoroughly. With subcision, I go multiple different levels. I make sure that it's really properly done. And I don't want to subject you to multiple subcision. I just do it properly, fully when I do it. So I have an extremely high satisfaction rate with subcision because of the way I do it. It's about like feeling the cannula. It's not about using too much force. You do have to use force in some spots, but really it's about like just really making sure that you're very, very meticulous as you do it and break that up there. Vanilla saying, are fillers alone enough for deep box scars with sharp edges? Good question. It may help a little bit, but a lot of times you'll find with box scars, they don't tend to rise as well as you may expect with filler. So you usually do want to undermine that still with a little bit of subcision there. So something, maybe even just needle subcision, something to do to pop it up a little bit more. And a lot of times you still need to do some sort of laser to smooth it down a little bit. Let's see here. Vanilla saying subcision didn't work for me, Sally. Lasers alone are enough from what I've seen. It depends on who's doing subcision. It really depends. It's like, that's what it comes down to. I've seen people say that subcision didn't work, but it's possible that the person didn't do subcision right. I'm sorry to say, but it's just a possibility. What I've seen kind of lately, it's like, over the last few years, I should say, there's a lot of people who are doing subcision who really shouldn't do subcision. There's a lot of people who do TCA cross who shouldn't do TCA cross. There's a lot of people who do lasers who shouldn't do lasers. And I mean, like people that are like, professional people otherwise with doing other things possibly, but they shouldn't be doing certain things. Like, it's like, not everybody has like I shouldn't say necessarily hands, but or skill set, but like I guess I should say desire, like and like the willpower to like do this properly. There's like a certain amount of willpower that it takes to do these things like all the time, really, really well. And not everybody has it. Some people really are just lazy. And it's like, I've seen them, and I see them in the OR, I've seen them in their office. I see that like a lot of times. It's just like, there's like a lot of people are just lazy. And it's like one of my biggest pet peeves in life is just that. Like, it's just like one thing I'm never going to have like, by the time I'm retired, I'm done with everything I do in life. I just like, nobody's ever gonna be able to say I was lazy, like ever, because I just like do it, and I do it properly, and like I just want to make sure that everything's done really well for people. So it's like, yeah, there's a lot of people out there that just like, people say that like this was not done well and this was not, and be like, sometimes I see the way they did it, and it's like, that was probably kind of like, you could have done better. You could have been like less lazy, to be honest with you. Maybe like you should choose something that like allows laziness, and you can succeed at that. But like whatever this is, it's probably not gonna be the world for you. Marin is saying, is a phenol peel more effective as a treatment for acne scars compared to laser resurfacing? It depends on what kind of scars there are. It's not going to be effective for deep ice pick scars, I can tell you that. But it could be for like thick rolling scars. So it could be for that, especially if you did undermine it with subcision. That it could work. Let's see here. There's a lot of licensed professionals who shouldn't even be licensed. Sav is saying, yes, absolutely. Really, and now, I see a lot of times people will say from other practice, other things sometimes that they're doing, and it's like they, they say they're board certified in something that's like, doesn't have boards. I don't know what the board is. Sometimes there's stuff like that. I don't know what's going on sometimes. Sav is saying, the other esthetician I work with says she needs to traumatize client's skin before I could treat it. Yeah, actually, I've heard other people say the same types of things. They claim that you have to do maximum settings for these lasers. You have to do maximum settings for this. Some people argue that you have to do 100% TCA cross for these scars. Otherwise, it's not going to work. It's because you're not patient enough. It's because you're just like, you don't know what you're doing with the stuff. Like, that's the reason why, and like you're ending up messing people and potentially causing catastrophic concerns. That's really, what ends up happening because you rushed it. Audrey's saying, if a patient doesn't get bruising from subcision, does that mean it wasn't very effective? No, that's not true. There's a lot of numbing solution that we put in there. So most people don't get bruising. Most people don't. The best cream for puffy eyes, I don't know. It's tough to say. I don't know what would be the best cream for puffy eyes. I've tried a lot of things, but I'm not sure if there's something that's just going to be like a long-term fix for puffy eyes. Lasers work for it. Other things could help with it, but really surgery could sometimes help with it. Someone else saying I look like Dexter's brother. It's interesting. I guess as I got into my 40s, I look like that more. I used to get other people, and now like a lot of people saying I look like Dexter's brother, which is interesting. I used to watch Dexter. It was really good. 182 is saying, what about for dark circles? Pico laser. Pico laser works really well for that. So that's probably one of the best options there. Let's see. Do you work on your own skin? Yeah, absolutely. I do. I do a ton with my own skin. What I mean by a ton is really just moisturizer, sunblock, and I use a pigmentation cream. So that's mostly what I end up doing. But lasers, like I try to do every 6 months, but I've been like way overdue. So I have to definitely do that at some point. Probably now after Christmas time though, or like around that time, I'll do, because this is like our busy time right now. So I don't have time to just go sit there underneath the laser. I wish I do. Honestly, if I had the time, I would do it like all the time. I would probably do it like once a month sometimes, like some of the stuff. But it's just, you want to like get done, and like when you're done, and then like you just go home. That's kind of how I do it. And so like when I'm done, I'm like done. Candle is saying, can you mix sculpture with radius or Bellafil? Does it increase chances of granuloma? I'm not sure if it does or if it increased chances of it, but I just don't do it really like that. Especially for injectables, I wouldn't really, see why you would do it that way. I do think that there may be a chance of more clumping with that though, so I wouldn't really recommend that. Let's see here. Where is my questions here? I've had so many, so I know I missed a bunch. If I missed it for you guys, just feel free to remind me. Kalina saying, I had my first CO2 fractional laser today. She didn't use numbing cream. It hurt so bad. Paid $180,000. I almost said $180,000 in New York City. Well, that's a really, really low price. I guess you're saving money on the numbing cream because it's expensive to do numbing cream. But I do like nerve blocks. I don't know. Honestly, that's like, I get like you want to save money for things like that, but like also there's a lot of work involved with these things. And you sort of have to wonder though, like what are you getting with this if it's $180? Honestly, there's so much involved with it. Cal Ray is saying, hi doctor, what laser do you use for bumps under the skin? Can it be done for people with melasma? Yes, it could be done. Usually I use the erbium laser for that. Usually I use that. The cutie dome is saying, do you ever treat wrinkles and scars at the same time? Yeah, I just did it today for a patient. Wanted for anti-aging purposes as well. So I did that for basically, really actually did it for from head all the way down to the lower part of his neck as well. Just worked on every aspect for him. Really, really great. Tried to tighten his skin too. Flew in all the way from Texas actually. Great patient. We actually did elliptical excisions for him, punch excisions for him as well. Very complex scars actually. An older patient. Complex scars, because as he got older with those deep, thick scars, he really did get a lot of loose skin, but he doesn't have the downtime right now for a facelift or neck lift. Laser is going to get him a nice skin tightening for him. It's going to actually be really, really nice as we remove some of the steeper scars. Really beautiful result then ultimately. Jawad is saying Phenol Cross or TCA, which is better? I use TCA Cross. I think Phenol Cross is probably fine, but I just have reputable pharmacies that give me TCA Cross. I know exactly the concentration of it, so that's why I use it. So I have no problem with it. I know people will try to argue that Phenol Cross is better, but I'm not sure why they're saying that. I'm not sure how they could prove that. It's kind of a moot point at this point, because like I've done so much TCA Cross and it's absolutely have no problems with it whatsoever. So it's like, maybe it was just the technique that they did or whatever they did for that, or maybe they just didn't have the right pharmacy. I'm not sure. Let's see here. KM is saying, where can I see the price for everything you offer? So just go to our profile. You'll be able to see at drqazi.com. You'll be able to go through and you'll be able to book directly on there. We have two websites, one for like the general practice, which is qaziclinic.com. And then we have one called drqazi.com. And drqazi.com, you could directly just book just anything you want over there. Pretty much, I would say most of our prices, almost all of our prices are on there. There's maybe a couple, a couple surgical things and things of that nature that aren't on there. But vast majority of prices are there. At least you'll have a general range for things for that. Let's see here. Does subcision cause micro swelling for a period of time? Usually for 2 weeks, but I usually just don't touch it again for any filler, things of that nature, usually for about 4 to 6 weeks for the vast majority of patients. So usually I wait a little bit of time. Kato saying, how long after sculpture can you get radius? You could do it at the same time. It just depends on where you're placing it and how you're doing it. I have no problem with either product. I actually love both products for what I need to do. For more volume, I do sculpture a lot of times when I want to do more for like skin tightening, or especially in this area, like the jowl area. I think radius could work very, very well for that. It does stimulate elastin production. It works really well though in the jowl area, so that way you don't actually end up causing it to get too heavy for the patients. So it works very, very well for that. So sculpture, radius, both beautiful products actually if you do it correctly. Let's see here. Sailor Moon saying, I love how transparent you are with pricing. You don't hide it after consulting. Yeah, I mean, really, we do try to be as transparent as possible. I just don't care if like people try to compete with me with prices. Anything that I know at the level I try to work with. I know how I'm doing things. So I'm happy to showcase what the prices are for people, and it's fair and it's transparent and it's open for people. And there is some variables. If some patients have more severe cases, then there is a little bit more involved with that, but it's not usually like that much more either. It's what the regular typical price is, and that I'm sure you're aware that you have some more severe scars, or there's an aspect or an element that does involve a little bit more work for some particular scars, something like that. And so maybe that will take a little bit more, but it's transparent. And we try to do it based on how long it takes for me in the room or how long it takes for any of the providers in the room. Do you recommend Juve Look? We don't have that over here, so I'm not sure. Sure, it sounds like it'll be good. It sounds like it's great, but we don't have access to it just yet. Let's see here. Kendra is saying the line going down from his nose. What do you suggest for that? I think you're talking about the little redness there. That's just we just need a little bit of a vascular laser. So we will use. Actually, we have used it actually now, which is the XLV laser. It works very, very well for that line. And it'll go away then. He's not too bothered by it, so I never really push it for him. Even this, this is kind of at this point, it looks even better. His eyes look amazing now. He's a patient who we did the treatment on him, and he's just happy in life. And now he mostly just does like hair restoration with us. which is also working amazing. Actually, we should one day show his hair restoration results. It's actually really, really good. Let's see here. No, not the wrinkles, the long wrinkles. I'm not sure what it's called. Let's see here. I'll just go back to that nose photo that she's referring to. Let's see, the line near the, oh, are you talking about like the brow area over there? So that's tough. You know, that really, if that's really like what their biggest problem is, then you may actually just need a full brow lift. You may need that. But the other option potentially could be to try a little bit of filler, and plus with a little bit of Botox. Sometimes that would help out as well. No, next to his nostril. Oh, okay, I'm missing it constantly. Okay, so the line, are you talking about the nasal labial fold? Is that what you're referring to? I guess I'm missing it here. Sorry, I'm a little bit confused with what you're referring to with this. Oh, no, the nasal labial fold. Oh, okay. So yeah, the nasal labial fold, we could place Bella fold there. In fact, I think we've actually placed a little bit of Bella fold subsequently, actually. I think we have done. I got to double check. I think we may have. It's been a few years, actually. He just, honestly, I see him in the hallway. I saw him recently. I saw him like last week or so. He was getting his hair PRP. And I was like, you just look so good. Like your skin, like you still kept it, and it's awesome. I love it. It's so fun, actually. It's really fun. You know, sometimes I don't see the patients every single time they come in because they may be doing like lighter treatments or like, you know, for this patient, he just for hair PRP. Sometimes I could see them maybe for Botox, something like that. But like his skin looks amazing. It's like skin goals. And he's like, yeah, everybody at work says the same thing. It's like like just de-aged, which is really cool. You know, and at this point he's in his 70s right now, and he looks younger than he did when he was in his 60s. Let's see. Sailor Moon's to the man looks like he's in his 70s. His line is actually not that bad. No, it's not that bad. Yeah, he's in his 70s. It's really not that bad. His skin is goals. Yeah, it is goals, right? Like it really is goals. It's like, and it's also just like tight and firm. So it was like this amazing collagen response that occurred, and it's like he gets to keep it. Nurse Kinsey saying your results are amazing. Appreciate you, Nurse Kinsey. Appreciate you. Candy is saying, I've seen you put Sculptra on top of skin after laser. Doesn't that cause bumps since it's superficial? Good question. I use a really dilute form of the Sculptra. We're doing it through the laser tunnel holes. We don't really run into problems like that at all. Not even a little bit, actually. It's mostly for just stimulating some collagen production. Don't run into any problems when it's really hyper dilute like that. Miriam is saying, if my face looks skinnier after thread lifts, can I get filler to make it fuller? Good question. So if you basically pull back maybe like the buccal fat area, and now it looks a little bit skinnier, now you want to get it fuller. Well, I probably wouldn't touch that because the threads are going to go away and you're going to get that fat basically to pull down again. And so I doubt that you would want to touch that at this point. Really just, likely you're not going to want to touch much of that at all for right now. If it's more like it's revealing some dents, I remember you were telling me about this, that you were going to do the threads, and I was saying that there's problems sometimes with that as it displaces some fat and maybe a little bit uneven, and chasing it with filler could be a little bit of a challenge unless it's just like a lighter filler, or you just do like a collagen stimulating products like I was talking about, like a dilute form of Radius could be an idea. Let's see, Bhavan is saying, what type of brow lift is good for sagging eyelid? So yeah, you could do like a lateral brow lift. My partner does that. And you, of course, could do upper blepharoplasty. That works out really well. And in this case, actually, for this patient, he's a lighter patient, so we ended up doing laser around him. This is basically like almost laser eye surgery around there for eyelids. It worked incredibly well for skin contraction. But he's also, Fitzpatrick 1, it was easier to really go pretty intense for his patient. So let's see here. Ardit is saying, how come you don't do PRP injections while taking Accutane? You could do PRP while doing Accutane. I'm not sure. I haven't heard anything about why you would not be able to do that. But it's a little bit odd of a thing. Not question, I should say. I should say it's an odd statement that someone said that you can't do PRP while on Accutane. I'm a little bit confused by what they're referring to with that. I'm not sure. Why would you not be able to do that? Unless you something like Accutane's causing a liver problem, and that's a bigger problem then. What smoothest skin? These are lasers. Lasers smoothest skin. Lasers are amazing. This is laser season right now. Do lasers. Sometimes just for regular anti-aging patients, it's just really fun for that, just to like help out, just making sure that like preventative, just to make sure that you age really gracefully. It can be a great option. This is the time when everyone's doing it. This is CO2 as well as erbium laser. That's what I did for this patient. I did both of those, fully resurfaced the patient. Can you do PRF with active pimples? You could, I don't see why you wouldn't do it. I guess it depends on what you're trying to treat though. If you're doing it for like, under eyes, things like that, that's different. Try and do like a little bit of healing, that's okay too, but I'm not sure what you're doing for that. Do you use Deep FX for atrophic scars? Yeah, sometimes, I don't think that you really need as much energy as you have with that, though. I think almost any CO2 laser could work just fine for most of those. There's a lot of different things involved with it. And I tend not to use, like, I have it. I don't use, like, the aggressive settings that they have on there. I don't. Let's see your last questions here. Mariam's saying, would you be able to make my face look fuller with filler if I get a facelift instead? Yeah, with a facelift, after the swelling's gone down, it's really settled in, really about 6 months or so afterwards, then we could take a look to see about that. Usually you want to do a little bit of volume when you do a facelift, like something like fat transfer, though, when you do a facelift, so potentially. All right, guys, thank you so much. I will see you again tomorrow. I'll be on here tomorrow. I appreciate all the comments, by the way, for all the people that were saying really, really nice things. Appreciate all of you. I'll be on here tomorrow for any other questions. We'll be